A man developed a cough. This is what happened to his brain. MP, a 40-year-old man presenting to the emergency room complaining of severe headache. He says it gets worse when it coughs. He is suffering from cold, according to him. This could mean a lot of things, like just as common cold, or even a tumor or a bleed in the brain. The doctor then asked him where it hurt the most, as headaches, based on the location of the pain, the time when they occur, and their duration, can explain what is causing them. Anyways, he explained that his headache was all over the head. Very vague description, but we can work with that. When asked how long he has had these headaches, he said that it would come and go, and it started 3 weeks ago, and it's slowly getting worse. When asked if he had any blurring of vision or any other symptoms, he said that he has nausea and he did indeed suffer from blurred vision. This gives us a clue as to what might be happening. Nausea and blurred vision are commonly associated with migraines or any other chronic headache conditions. Upon inquiry of the medications he is taking, he explained that his colleagues gave him a pill, and that somewhat helped. When asked him what it was, he didn't know. However, he did say that the headache did get better when he laid on his bed. This may be a clue as to what the patient might have. When the headache subsides sleeping on the bed, it can be due to increased intracranial pressure or the pressure between the brain and skull. Generally, due to a brain tumor or even excessive bleeding in the brain, can press the skull towards the brain, not the brain towards the skull. This can obstruct the flow of the cerebrospinal fluid produced by the ependymal cells. It bathes the brain inside. Your brain floats inside your skull, and this CSF flows all the way through the spinal cord. It acts as a cushion from injuries and also provides nutrition to the brain and transportation of hormones as well. The patient, when asked to remember what he ate in the morning, he couldn't recall, which means that he has issues with the short-term memory. This is a clue, as there could be possible brain damage. We don't know, however. The symptoms MP is describing can be something incredibly dangerous like a tumor or a bleed that need to be addressed immediately, or maybe it's nothing and he's just confused and scared in the hospital. Before running any tests, the doctor asked him if he had any previous surgeries or any other injuries to the head. He said that he had his appendix removed 20 years ago, and he had a concussion from a car accident 4 years ago, but it wasn't major. According to him, he had a bit of headache after the accident, but nothing serious. However, this piece of information raised suspicion of rather rare diagnosis, which should be ruled out. Remember, the cerebrospinal fluid? It has something to do with that. Comment down below if you know what the diagnosis is. Anyways, the doctor performed a CT. Came out normal, which was odd because if there was any bleed or even a tumor, it would be visible. However, the patient was still complaining about headache, so the MRI was ordered. The MRI found that the meninges, or the layers covering your brain, there are 3, were enhanced or appearing too bright, and also a bit of bright spots between the 2 lobes of the brain, the subdural space. They should generally be completely dark, but there are some white grey spots. Let's understand how MRI works. MRI shows brain as lightish grey color. Meninges, or the covering, are slightly brighter or a slightly whiter shade. However, this patient's meninges were too bright, indicating there is something inflamed in the meninges. The patient has no family history of any neurologic problems and is an occasional drinker and not a smoker. The patient also doesn't have any fever or any neck pain, so we can reasonably rule out meningitis. The doctor then performed a lumbar puncture. Because the pressure was too low, the CSF gushed out of the needle slowly. This gave the doctor his diagnosis. The accident he had 4 years ago, which he claimed was nothing severe, might have caused the symptoms. He started leaking CSF due to a tear in the meninges. This loss of CSF causes a drop in the pressure, which should be around 15 to 20 millimeters of water to around 4 millimeters of water in this patient. So that is very low. The brain produces about 500 ml of CSF a day, and around 150 ml of it is present at any time. However, this patient must have much lower than 150 as it was leaking. Remember when I said that CSF provides nutrition? The loss of memory can also be explained by the damage to the brain due to the lack of the said CSF. The doctor then injected a bit of the patient's blood into the punctured hole called a blood patch. That increased the pressure enough to treat the headaches immediately. Also, he was given caffeine pills and was told to rest for some days, and he made a full recovery. If you like this video, please like, share and subscribe and wait for more.